start admitting folks. They're going to pop up on our screen and we'll get going.
In the summer, I know has maybe put a damper on.
All right, looks like we have everyone joining as of right now. Good afternoon, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live media briefing. I just a couple of housekeeping items just right off the bat. Just remember to please keep your computer or your laptop or your cell phone on mute. If you have a question, if you can put it in the chat, that way we can keep everything in order and we will get to your questions as they come in. But I want to introduce to you now both of our guests, Dr. Ajay Kumar, our Chief Clinical Officer for Hartford Healthcare, and Dr. Ulysses Wu. He's Assistant Director of Infectious Diseases for Hartford Healthcare. And they're going to give you a COVID-19 media briefing update, and then we'll take questions at the end. But for now, Dr. Kumar, I'll hand it off to you.
Thank you, Tina. Good afternoon, everybody. My name is Ajaykumar, Chief Clinical Officer for Hartford Healthcare. We come here today just to talk about where we are in terms of a COVID census and what we are seeing in the system, and hopefully answer some of the questions you have around the breakthrough infections as we've been noticing across the state of Connecticut. Today, we have 107 patients across the system. We have largest number in Hartford Hospital as 32 patients. Bacchus Hospital has 20 patients. Charlotte Hungerford has 6 patients. Midstate has 20 patients, St. Vincent has 15 patients, and Hospital Center Connecticut has 22 patients. We also have 2 patients in Wyndham Hospital as well. Now we've seen this surge to be maintaining at the peak right now. We've plateaued out for several weeks. We saw a significant increase on 26th of August. That was a peak, and after that we've seen the numbers around 110 hovering around that number from that time. What's most important to know is that we still have very few patients who are vaccinated requiring ICU or critical care at the moment. We have large number of patients who are unvaccinated requiring a significant amount of care such as oxygen, ventilation, and other support. The trend continues. We have noticed that the breakthrough infection, which is defined by somebody who's been fully vaccinated more than 14 days out from the last vaccination, have been hovering around 25% of those individuals in the hospital requiring hospital stay, 25 to 27%. But most important thing to note, that less than 10% of those individuals with breakthrough infections are coming into the hospital because of COVID per se. Most of them are requiring, we test everybody who comes to the system and we find those individuals tend not to be positive. There's good signs out there. The good signs of the positivity rate in the state of Connecticut is lower than before, at least lower than last 3 weeks ago. The numbers have been stagnant, at least in Hartford Healthcare and throughout the state of Connecticut. We've been at the plateau at the moment. And at this time, we continue to push the vaccination in our community, among our colleagues. And we still think this is the best approach right now to be able to manage the pandemic and hopefully get to the other side at this time. We have not seen what the Labor Day related peak might look like. We are still concerned about that, but given we are about 10 days out, 9 days out, it's not significantly impacted us so far. We continue to run our projection models. We are concerned about the respiratory infections which we'll be seeing in the state of Connecticut, at least in winter, coming winter or late fall. But we're well positioned to manage that at this time. And this is more of a reassuring message to the community. The vaccination, as we drive and as we improve in the vaccination rate, I think we'll be able to manage the pandemic well as we go forward. With that, I'm going to pass on to my colleague, Ulysses Wu, our Assistant Director for Infectious Disease, for any additional comments. Ulysses?
Yeah, thank you. I think you've covered almost all of it, or you actually have covered all of it. And I think the one thing I do want to reiterate, because we are seeing a national look, the way that people are looking at vaccines is that they were looking at it as prevention of disease, and that's really not the way to look at it. Certainly the vaccination does offer protection, and there are people who have been protected from coronavirus. But as Dr. Kumar has covered and has pointed out, it is really about protecting those who get the disease and making a severe illness and turning it into a less severe illness. And that is the message that we are trying to communicate for the vaccinations. That's it, Dr. Kumar.
Thank you, Ulysses. We'll open for any questions at this time. Nick is asking what preparations are being made by Hartford Healthcare for vaccine booster rollout. Nick, we are very well positioned. We send out messages to everybody who in the first round with immunocompromised status for vaccination. We have a fair amount of capacity in our acute settings and existing clinics, and we're looking into other expansion in community-based clinics as well. I think one of the important things to note that the Hartford Healthcare has had a very robust mobile platform to provide vaccination to individuals who have difficult to get the boosters or vaccination. We'll continue to meet the demand as boosters are rolled out across Connecticut.
We have a question, Dr. Kumar, this is for you, for Mike Savino. Can you clarify your comment that only 10% of breakthrough cases coming in with COVID, are they coming to the hospital for something else, but then testing positive for COVID? And is it 10% of the 25% of breakthrough cases? That's Mike Savino from Channel 3.
Yeah, and I think the similar question from Tracy as well. So essentially, we are seeing that about 25 to 27% of the patients who are in the hospital today have had vaccination completed. However, only 10% of the total volume, we are seeing they came with COVID-like symptoms. Most of them are coming with falls or trauma or cellulitis or something else. And because we test everybody, they turn out to be positive. But most important thing to note that those 10% of the people, or about 10% of the people who actually are coming in with breakthrough infections are generally well managed. They're not requiring significant amount of critical care or ICU care, and they do make good recovery as well.
Erica Moser is from the Day newspaper. Can you talk about the Connecticut College outbreak? There have been 169 positive student tests over the past week, but 98 to 99% of students are fully vaccinated.
Erica, this question is probably best addressed by the Connecticut College rather than me. I think we have to be always careful about the unvaccinated individuals getting COVID. What I know of the numbers, at least, that the large number of individuals who are positive were unvaccinated, significantly large number of individuals who were unvaccinated. Although the 99% or 98% may be vaccinated, but the N could be large enough, especially the student body, there's a fair amount of still unvaccinated.
Eliza Fawcett from the Hartford Current is asking, how available is COVID-19 testing right now? And does Hartford Healthcare have any drive-through sites still open, or will that reopen in Newington?
Eliza, we have a very good capacity to manage the testing at this time. We have, if you remember in last year in March and April, our concern was swabs and kits and other availability. We are well positioned at this time in terms of COVID testing. We do not think at the moment the drive-through will be required. However, we are carefully assessing that at this time here. If there's a surge, we will certainly provide the options for community to seek additional testing. And testing is also done through our urgent care platform, through GoHealth and a variety of other means as well, where individuals can get testing. We have increased the number of access points for testing right now significantly across the Hartford Healthcare.
Dr. Kumar, Mike Savino from Channel 3, a follow-up question. How prevalent are the Lambda and Mu variants in Connecticut? How concerned should we be about them? That could be for Dr. Wu as well.
Yeah, I think I'll pass it on to Dr. Wu to talk about that.
Oh, gee, thanks, Dr. Kumar. I appreciate it. No, I'm kidding. The Lambda and Mu, so for those of you who may not know, are some of the variants, and we always expected another Greek letter to come down the road. The Lambda being, I want to say, the originally from Peru and the Mu from Colombia, they are present in Connecticut, but its clinical significance remains to be seen at this point. It still needs to be studied. Right now, the CDC views these as variants of interest, but not variants of concern. And the things that we have to look at with these variants is what is their infectivity potential? What is their R naught, for example? Are they resistant to things like monoclonal antibodies and things like vaccines as well? All this needs to be studied at this point. They are concerned about some genetic mutations on some of these variants, but right now, clinically, what they've noticed so far is that it is not necessarily something to be concerned with just yet. It is just a variant of interest. I don't know if that answers the question.
Thank you, Ulysses. I don't see any other questions, but I see Tracy's hand.
Tracy's
being
hand is
raised.
up. Tracy, go ahead.
Yes, doctors, can you hear me?
Yes, we can hear
Yes.
you, Tracy.
Okay, forgive me. I was trying, Tina, to type this all out, but it was too long. Forgive me, but I wonder if you could talk a little bit about the boosters. They, as you know, should be available, I believe, on September 20th. Are they, first of all, are they the same dosage? Is it the same thing that the vaccinated got earlier on? Secondly, do you have to get the same type? Is it only for Pfizer right now? And finally, the people who got the J&J shot are asking, what about us? What are we supposed to do? Can you help?
Ulysses, you want to take first,
Absolutely.
and I'll follow up after that.
Yes, it is expected to be the same dose. I do not expect any changes in that. With regards to what you were referring to as can you get a different shot, they're calling that the mixing and matching of vaccines. Now, there is the likelihood that that will be something that you can do in the future. But as of now, you can only get the booster of the same vaccine that you had received before. I do understand there's a lot of J&J anxiety out there. And J&J is going through the process to make sure that they are dotting all their I's and crossing their T's. In terms of a timetable, I am not sure what the J&J will be. I do believe that it will be improved, but I do believe that it will be, unfortunately, not at least for another month or two at this point. Dr. Kumar?
Thank you, Ulysses. And just to add on some comments regarding one of the question on chat box right now is about the confusion about the boosters. Who's eligible? How do we go about that? So let me just recap. In early September, when FDA had approved boosters, it was only for immunocompromised individuals. Hartford Healthcare's website was very quickly updated, and we have a very sophisticated portal for those individuals who can check their qualification and schedule a booster in any of our locations. And also we accept any physician note. If they're not meeting the conditions listed here, the physician can write a note, my patient qualifies for vaccine third dose, and we will be able to honor that and make sure the patient actually gets the vaccination. As the conversation develops regarding the third booster for larger population, as Dr. Wu just mentioned, when we learn more from CDC and ACIP, we'll be better. We'll update our website. We'll inform the public about how the boosters can be sought. Generally, we are looking forward to the rolling out the boosters. Hartford Healthcare is ready. We have a capacity. We have a fair amount of infrastructure built in to deliver the third dose for the community.
Thanks, Ajay. That question came from Nicole Leonard from WNPR. So Nicole, thank you for the question. We have a couple of follow-up questions from Tracy. Do you think that we need a booster after 8 months will undermine the tenuous confidence in the vaccine?
Tracy, I don't know whether I understood your question completely. Would you be able to speak to that? Well, Tracy.
Yes, sir. Can you hear me?
Yeah, we can hear you.
I beg your pardon, doctor. So as you know, there's a lot of vaccine hesitancy and resistance. I think we have about 80 million people who are unvaccinated as of yet. And I have heard many comments to the such as, Now we understand it's this vaccine we got is not any good because you got to get another one after 8 months. And I wonder if you could talk about that, if you could talk about why it is with this particular virus, we need a booster in what seems like a very short amount of time versus, say, tetanus, which is 10 years, or other vaccines. Can you, and whether that actually makes people less confident in the vaccine?
Ulysses, you want to take this on?
Yeah, absolutely. I think it's a good thought, but there's a lot of other examples. And so what we're doing is we're only looking at, well, why can't the vaccine be this? So a good example I would look at is influenza. Influenza is a vaccine that we certainly have to get yearly, or we should be getting every year. And then you would look at the characteristics of the coronavirus itself. Before COVID, there were 4 circulating coronaviruses that were causing our general common colds for the most part on a yearly basis. And we weren't developing immunity. We would develop short-term immunity, but we weren't developing long-term immunity. So I think that speaks to the nature of the virus itself. It shouldn't undermine confidence. In fact, it should, in a sense, it should increase confidence, because we do have that capacity to be able to adjust. And should there be variants, we can adjust very quickly to have a vaccine that would be ready. But I do understand that the angst that would be going with having to get a vaccine or a booster so often. But right now, the science says that I think I don't foresee that as a problem at this point. So, Dr. Kumar?
Thank you, Ulysses. I think Tracy asking a great question. The public confidence regarding the boosters is, the questions about the boosters are very valid. I think we need to continue to highlight that individuals who are not vaccinated have significantly high mortality. Still, after 1.5 years of dealing with the pandemic, there was significant suffering in the ICUs and critical care at this time here. We have ample of evidence right now the vaccination has reduced mortality and reduced hospitalization. So, I understand the question is about the boosters, but overall, the vaccines are much safer and they're the right strategy to prevent death. And I hope most of the members who are concerned about the booster should be concerned about mortality at this time or the risk of unnecessary suffering or hospitalization.
Ajay, Nicole has a follow-up from WNPR looking for an update on where Hartford Healthcare's vaccination rate stands among staff and employees, colleagues.
So Nicole, thanks for asking this question. Hartford Healthcare is very well positioned right now. I think our colleagues have really stepped up and received the vaccination and done a great job. We've still got a few more weeks to go, a couple of more weeks to go. We are more than 97% vaccinated among the clinicians and physicians. We are almost 99.2% vaccinated right now. We've got a few individuals who are locums and other things which we are trying to chase right now, but we're very well positioned. I'm pretty confident, minus exemptions, Hartford Healthcare will be in a very good position with vaccination rate by the end of September. And I'm very grateful for our colleagues to stepping up and asking the right questions and receiving the vaccination at this time.
Mike Savino from Channel 3, follow-up question. Pfizer could get approval for 5 to 11-year-olds as early as this fall. Do we have any concerns about meeting the demand if that happens?
Mike, from my knowledge or the conversation I've had, we don't have any concerns about the demand or supply at the moment. Supply at this time, I hope the demand continues. The supply is not an issue as been indicated by the state authorities so far.
Anybody else have any questions? That's all I see in the chat for right now, while we have both of our experts here.
Nicole, I just want to correct my numbers 1 second. Among the vaccination rate, we have about 97% full-time employee vaccinated in Hartford Healthcare. Thank you.
I do want to highlight one thing as we wait for other questions to come in, and I don't want to lose the forest through the trees. I think what Dr. Kumar said before, if you take a step back, the vaccine works. regardless of everything that needs to be done, whether it's boosters, whether it's, waiting for approval or uncertainty behind J&J or Moderna or Pfizer, whatever it may be, the vaccine works. And this is our pathway forward if we're ever going to beat this disease. And so that's the bigger picture that I want everybody to make sure that they understand. We've certainly prevented a lot of morbidity and mortality with these vaccines. We wish we could do more. And the more that people get vaccinated, I think the lower those numbers become.
And good point, Dr. Wu. And just a clarifying question from Tracy. Can you explain the 4 COVID types and the boosters again?
Oh, sure. I don't want to go into the details about coronaviruses in general. There's multiple coronaviruses, a dozen and a half that are circulating. Some of them infect humans, some of them do not at all. But the common cold, the coronavirus, was something that we saw before COVID, and that was maybe 10 to 15% of the common colds that we would see on a seasonal basis. So I don't want to confuse it in terms of COVID and the COVID-19 and the boosters that are associated with COVID-19. It's a completely separate issue. The only reason I brought it up was I wanted to talk to you about the seasonality and the immunity that is associated with this virus, that it is usually not long lasting at this point. I don't know if that answers your question.
Yes.
All right. I don't see any other questions. We do have just a few minutes left. We have until 2 o'clock with our experts. Ajay, do you want to add any final thoughts? And Dr. Wu?
I think we've talked about it before. I do want us to, as media is a very important partner of Hartford Healthcare or the healthcare systems in general. And I think I would request all of you to communicate the importance of vaccine as much as possible. Our first-hand experience and ample of data with millions and millions of vaccinations we've given across the world, we have seen it does reduce mortality, it does reduce suffering. Individuals should be asking questions if they have concerns about the vaccine in itself, and hopefully make up their mind based on science as we go forward. Ulysses, anything else to add?
Yeah, I definitely agree with all that. And one of the things that we're hearing about the vaccine that I see out there in social media is, well, why bother get the vaccine because I still got it anyways. Again, it's not about not getting disease. It's about taking the deadly disease and making it a more benign disease. The other thing that people forget is that we tend to be centric when we get these vaccines. The vaccine's not only for ourselves. The vaccine is hopefully to help us prevent transmission to others as well. And that is the whole point of vaccination. We need to stop transmission. You cannot get COVID from just nothing. You have to get it from somebody else. And the more we can decrease transmission, the more that we can beat this. And actually, I'm going to answer the next question. Do you think federal mandates for vaccination will increase our vaccination rate or cause greater resistance? I don't know if you're talking about viral resistance, but if you're talking about virus resistance, it's actually going to decrease it because there's going to be less transmission. If it's talking about vaccine hesitancy, I'm going to pass that over to Dr. Kumar and let him answer that one.
I think it's a really important question, Tracy. I hope it actually increases the vaccination rate across the country. It's difficult to understand sometimes psychology of the individuals actually who are vaccine deniers or vaccine hesitant. They may just dig in a little bit more at this time here. But at the same time, I think where we are in terms of mandate, in terms of widespread utilization of vaccination, from a healthcare standpoint, from the public policy standpoint, to improve the health of our community, it's the right thing to do. So I'm hoping this is going to be seen as a positive, is going to be seen as something which is going to make our society much safer as we go forward.
All right, it looks like those are all the questions that we have. I want to thank everyone for joining us, Dr. Kumar especially, and Dr. Wu. Thank you for leading the charge and keeping everyone updated. We appreciate your expertise as always.
Thank you.
Thank you, everyone.
Thank you.